Hi everyone, Aaron and Chris with Perfect Postures. Today I want to talk about something that we've been seeing an awful lot of lately with the younger, usually with kids, in their either early teenage years or younger, and it's a condition called Sever's disease. And we've been seeing so much of it lately that I just thought it would be important to talk about it. One, because there's so much of it, but two, to show you some of the mechanics that we're seeing that I think a lot of the healthcare is not really identifying with. So basically, the Sever disease is where the Achilles tendon, which is this cord in back of the foot hair or back of the calf that attaches to your heel bone, your calcaneus, where that attaches to a growth plate, and it gets irritated. So there's a lot of swelling, inflammation. One of the things is they talk about the inflammation and why that occurs, and this could be due to, obviously, that the tendons aren't growing as quickly as the bone, and that creates tension on that tissue, which creates inflammation. Here at Perfect Postures, we're always looking at things from a biomechanical point of view, and although it may be important to stretch your calves and keep that as pliable as possible, which is important, there's one key thing that we've been encountering quite often, and what we're seeing lately is that kids are coming in, their feet are slightly toed out, which is normal. You want to be slightly toed out is okay, but what we're seeing more importantly than that is that the hip is actually rotating inward. So what you would see is that you'd see the knee kind of turning inward. So you showing that, Chris? Yep. So it's kind of twisting in that way. So what'll happen is, as that rotates in, it's actually putting more pressure toward the inside of the foot. And when it collapses in like that, it's putting more strain on that tendon, how it attaches again to that heel bone, the calcaneus. So that's something that's really important to identify. If someone in your family or someone that you know, or maybe some of the kids on your son or daughter's team are experiencing that, maybe have them take a look, or have their doctor or have their PT or someone take a look at that factor, that internal rotation at the hips, which is causing the foot to collapse. Another thing to note is if it's only on one side, then it's even more important to look at it from a biomechanical point of view than it is if it were just a bilateral or both-sided situation. So what we're going to do for the correctives or the corrective exercises in the next video, I'm just going to show you a quick little sequence of exercises that we use for that type of condition. So if you have any questions, please feel free to contact us. Thank you.